when the gut lining becomes compromised, it's no longer, able to really protect the body and do things that the body needs. It leads to something. What's really happening here is metabolic dysfunction, and we know, just like Dr. Gum talked about a few weeks back, stay true to your chiropractic philosophy with thoughts, toss, and trauma. And many of your chiropractic patients, they're going to need more than just adjustments to truly heal. This chart really shows the gut barrier and how things like high sugar intake, poor fats, insulin resistance, which we know they have, begin to break the body down. And so when the gut lining becomes compromised, it's no longer able to really protect the body and do things that the body needs. It leads to something, as we already know, leaky gut, which is, increased intestinal permeability. But the point is, it creates inflammation, and that inflammation spills into the rest of the body, basically. And that inflammation doesn't stay isolated. It drives systemic issues affecting joints. So we're right back into the joint, what we adjust. The nervous system it affects, which we deal with. The nervous system deals with everything else. The immune system, of course, everything, the master control from the brain. So chronic inflammation feeds the insulin resistance. And here's what the problem that ends up happening with these individuals. The insulin resistance fuels the weight gain. And then the cycle keeps repeating. And nothing gets them off that merry-go-round except the things that we're offering here. So it becomes a self-sustaining, fulfilled prophecy of just this insulin resistance, this inflammation feeding the insulin resistance fueling the weight gain feeding the insulin resistance, so it just keeps going. And so when someone's nervous system is inflamed, toxic, overloaded, with stress chemistry, basically, their ability to hold an adjustment is just not there. The ability to heal or regain, the full function is going to be very limited. And this is why we integrated metabolic care into the BPA pyramid model, because chiropractic care is often the first step. It's the foundation. It stabilizes. If you look back here, that's what it's the stable foundation of it. So many patients need to upgrade, just like Dr. Kingsbury was saying, into the metabolic care to address the deeper systems at play, the inflammation, the blood sugar regulation, the gut health, the detoxification. So in short, you'll see chronic pain, stiffness, and you'll see your patient starting to plateau. So, I'm saying, so if you're brave enough to put in the chat, a thumbs up saying, yeah, I'm seeing patients plateau just, more than ever, because I've been in practice 17 years, Dr. Kingsbury even longer than that. And it's like, we talk about it all the time, like patients just don't hold their adjustments like they used to.